Hello and welcome to yet another talk therapy session episode brought to you by Driveway Devi. I'm Karthik on behalf of Driveway Devi. Usually, at least in India, what one observes is that there is a disaster of some kind. It may be in the realm of a climate related event, it may be a terror related event, maybe something smaller, but our entire approach and preparedness towards that realm tends to be reactionary, and therefore one is always, almost always, on the defensive. Rarely has it been observed that there is already an ongoing effort in a certain direction that can, in the first place, greatly reduce or mitigate that particular occurrence from taking place in the first place. And the reason I share this kind of a background, pardon me, is to simply demonstrate that a similar sort of approach seems to be adopted when it comes to mental health and wellness. And we're all equally guilty of that. We all find ourselves in that situation where we seek a more sort of healthy way of treating our minds if and when there is a specific type of distress that has birthed a condition or an illness. It might be therefore worth investigating that time is ripe, that instead of approaching it from that same treatment perspective, from that same place of remedial steps when something has occurred, that what might be a certain way of living life that ensures a stability and an equilibrium in terms of mental wellness and well-being in the first place. And joining us to talk about this is Neha Dhamija. Now, I'm very poor at making introductions, but I will say that Neha is somebody who's fiercely passionate about this sort of an approach and lifestyle being the way one should be. And the very cliche but extremely relevant sort of mantra of prevention being better than cure. And she's had her own tremendous evolution and journey, which has seen her go from being a clinical psychologist with vast experience more towards a spiritual bent and way of life. And I think it is perhaps through that very personal and profound journey that she's also come to the realization of how important it is to just lead a life that is well informed in to begin with. So we're very, very lucky and privileged to have Neha joining us all the way from the United States, despite the time difference, despite her being extremely tied up. She's had, again, vast number of years of experience working with leading schools, with students, and we're really looking forward to gaining from her insights. So I would like to thank Neha and welcome her.
Thank you so much, Karthik, for the lovely introduction and a good start to the meeting because I'm probably as guilty as anyone else of going through the diagnostic and curing methodology because I am a clinical psychologist. And the reason I did clinical psychology was because I saw myself sitting in a hospital and treating clients coming with mental disorders. So, but thankfully, and all thanks to divine grace and intervention, it didn't work out the way I thought it would. And of course, when you look at it, you never get what you want. You're always given what you need for you to grow, for you to explore and to reach your fullest potential. So I'm very happy that my life took that turn, and I'm very happy to share this space with you. And yes, I'm very passionate about mental health, and anyone who does a good job like you are, and you're making such a contribution, it makes me very happy.
Thank you so much. Just to quickly sort of underscore that, I've come across so many people, and I've been in that situation myself when where I'm simply trying to say, and of course, it will be, you will know that better than anyone else, that when one does develop a particular condition or illness, and oftentimes there is a certain amount of time, in certain cases, there is confusion accurately identifying what it is. That itself can be hugely disconcerting until a point to which we can put a label on it, because that mystery is very, very unnerving to most of us. So while that work is of critical importance, of course, what we are talking about is a completely, sort of perhaps healthier approach altogether. Very quickly, then, Neha, if I may ask you in your own words to tell our viewers a little bit about your practice, and in a sort of nutshell, if you will, your own evolution from that very clinical realm to where you are now.
Um, sure. So my practice is mainly seeing adult clients now, but it was a lot of adolescents and all the stakeholders involved, and children while I was working in a school. Um, how do I say this except that when you become spiritual, or when you start walking the path, you cannot become spiritual, let me correct myself. When you start walking the paths, uh, it changes the foundation of who you are. It doesn't affect the small things, it doesn't affect outwardly behavior. It changes how you think about yourself, how you view the world. So it changes your entire perspective. And I will be very wrong to say I chose spirituality. It was, of course, my guru's grace and divine grace, because of which this path was open to me. That's the first difference that comes to my mind, that you don't really, yes, you make a choice, and every human being is given that choice. I believe that. But there is something greater than you that allows you to walk that path. Whether it was the environment I was in, it was, materially we were sound enough. I did not have to worry about the basics. I was, of course, blessed enough to have my guru grace us, and all of that. So a lot of things play, so that there is a higher intelligence at play here. When you start with that and you understand how things work out for your benefit. Psychology I chose in class 10th, when I first, when it was time to choose careers, and the minute I heard about psychology, I knew this is something I have to do. I was, of course, contemplating journalism and arts and all of that, but psychology, the minute I heard it, I knew this is what I have to do. And when I had a chat with the psychology teacher in school, and she told me this is the process and this is how. So that very day, I decided that I have to be a clinical psychologist, because it will give me the independence I want. I can work independently, all of that, and I need a license. So that happened, but fortunately, at the same time, spirituality did start stepping in. So right from school, I had the opportunity in class 11th of interacting with my guru, and learning from her. It was very superficial at first. I have to say that. I was a kid, like all kids are, but it just grew over time. So how now it affects me is, it changes your worldview. It makes you more compassionate. It makes you look at your clients as not only greater than the sum of their parts, like the Gestalts very clearly say that the whole is greater than the sum of its parts, but they are much more. They are also dynamic, they are also changing. So I think at the grassroots level, the foundation changes when you start walking the spiritual path and you understand so many things. And more than understanding theoretically, when you experience it. So it really translates into your own therapeutic practice, because yoga is a way of life. Spirituality is a way of life. It's not something you do in isolation.
Sure.
So I think that's what it is.
Well, you've articulated that very beautifully, but I mean, obviously, you have a certain set of beliefs which I wholly respect, but you are simultaneously very modest, I must say, which is a very endearing quality. But I will add my two bits here, which is that while you talk about let's say the universe opening up certain paths and choosing the individuals, I do believe that those opportunities and pathways and windows and doors open up to very, very few and special people, and the chosen few. So that certainly must be said, and I'm so happy that you're one of them. Okay, let's get into nitty gritty. There are a few central questions that come to my mind when we talk about our theme. I'm going to ask you two of them and request you to answer them in whatever way you seem logical in terms of chronology. Now, one, of course, is that what might be certain practices or elements to keep in mind if one is to tell oneself that, yes, I want to lead a more mindful lifestyle and way of being, and therefore I want to be in this space where I really sort of address and look at alleviating my mental wellness on an ongoing basis. But what happens in my mind is that जो मेरी understanding है of several elements that would be part of that process of and way of being are also deeply connected with societal constructs, with deeply embedded practices that we all know are euphemistically passed off as culture, tradition, a rite of passage, vagara vagara, but are I'm just going to say social evils like patriarchy, etc. So, I would want you to talk about both these. So, whether you want to, address the my second thing first and then come to the elements that are to be kept in mind, because my point being that while I may decide to lead a certain kind of life, there will be things entirely beyond my control which will prevent me from doing that.
Absolutely, Karthik. And I think patriarchy is much talked about. We don't talk about the lesser evils So I was just, while I was thinking about what to say, and I just attended a webinar yesterday, and I was thinking, one of the greatest evils in our society or our culture is that we overprotect our children as parents. So, this whole idea of autonomy versus protection, which they say is protection, but it's basically just mollycoddling our children, that is something so deeply rooted in us that it's very difficult for parents to let go. And I've seen this in my experience as a school counselor, but I've also seen it in my personal life. And how you strive for it, whether you want it or not. Again, the question is that for us, society decides what's right and what's wrong. So, the first step here that I would like to say is take a call yourself. See what works for you, what doesn't work for you. It may not work for you. I was reminded of an incident in class 2. When I was in class 2, I was young as that. So, a parent teacher meeting, my mother goes to school with full mode saying, I'm going to complain about you to your teacher. And, we had a single teacher concept at that time. So I was in awe of my teacher. I hope she listens to this whenever she is. But so she goes and complains, look at her copies, there are all red marks in it. I tell her, this is what you're supposed to write and this is what you're supposed to do, but she doesn't listen to me. So my teacher had the presence of mind to send me out of the room, go play. And then many, many, many years later, I was told that my mom actually got a scolding from her saying that she's trying to be independent, thinking for herself. If she makes a mistake, it's my job to correct it as a teacher. Why are you putting your thoughts in her head? Let her do. You can suggest, and that's it. And I can't tell you how that has impacted the way I have developed. That day onwards, my mother has never had to see what I'm studying. I finished my MPhil and everything. She never looked into my studies until I specifically asked for help. Now, it worked for me. It may not work for my sister, who needed more of my mother's guidance and control. Not that she's not intelligent, but there's a different way. So I think the
Yeah.
first thing here is you decide for yourself.
Can I
Because
quickly
society.
interrupt you, please? I can't help myself because I'm getting a bit emotional. Good, you're not physically across of me, because I would have gotten up and given you a bear hug. And I'll tell you why. I'll tell you why, because in any case, मैं आपसे पूछता that in my own personal interpretation of when you say more autonomy or agency to our children and not mollycoddle, is precisely this, precisely the ability to experience, form opinions, and make decisions for themselves. Of course, nobody's suggesting that you tell a grade 5 student to decide about their careers, but age appropriate and whatever those decisions may be as that person evolves is so important. And that is really what has been the core of what I've been trying to do through my teaching. Of course, I don't tell most parents my hidden agenda because they tell me I'm trying to make their children rebels. But it's so important because there is absolutely zero ability of opinion formation and any kind of independent and critical thinking in not just Indian, but a lot of South Asian, by and large, students, because we just don't create situations where we ever ask our children for their opinion on anything, whether it's what to eat for dinner, beta se leke every, monumental decision in life.
Absolutely, Karthik. And I think that is what, as individuals, we need to understand what works. Again, as a parent, you know your child, you need to see what works, what doesn't work. Suddenly, for so many years, till about 18, 19 years, we are even choosing their careers for them. I've seen that happening, even if the child doesn't want to do science. This is a societal evil. For me, it is. It's more real than patriarchy because it's affecting our
Yep,
generations to
yep.
come, right? So for 18, 19 years, you are deciding for the child, and suddenly you say you should make a decision on it. How? When you've not allowed them to make a decision ever in their life, how are they ever going to do it? But
Absolutely.
again, it has to be a balance. You don't have to give them complete freedom because you are their well wishers. You are responsible for their well being. As parents, as teachers, we are responsible and we need to accept that responsibility. But we also need to understand that it's their life and they're going to make differences. So, starting with anything, also the very fact how we see disorders from your introduction, just taking from that over here to understand, we are looking at it as a disorder, as something abnormal, not equating it like not treating it like a physical disease that happens. Mental disorders are still not taken, and they're so culturally dependent that it's very difficult to make them understand that this is not healthy, mentally not healthy to feel so much anger. Forget about disorders, forget about anything.
Again, I'm. This is the last time I'm going to interrupt. I'm sorry. This can be actually, prefaced by saying, and just connecting the several very important points you've made, where I think I suspect it's a combination of being overprotective as parents and this very, very important, unfortunate reality where a mistake and a failure is frowned upon, right? So because that those two things are unacceptable, also is a big reason why perhaps parents think that, oh, so I'm going to sort of prevent them from making a mistake or prevent them from failing.
And that's the biggest uh, hurdle in their well-being. You know, when we talk about mental wellness, we are not just talking about an absence of disorder or a mental health condition. We are talking about their ability to make decisions, their ability to judge, their ability to analyze, their ability to regulate their emotions and to overcome obstacles. What we want to do, we want to thrive, we want to flourish, we don't want to just live. At least today's generation doesn't want to. They're looking for so much more. And it's very important for them. You know, Martin Seligman popularized the idea of flourishing, what we call, is to grow, to develop, to explore, to reach our fullest potential. And for that, it's important to resolve conflicts. It's important to overcome problems, and it's important to fail, because it's not a happy life. It's never going to be a perfect life for any one of us. And I think maybe not now, but the generation I saw in school, maybe kids who are now 15, 16, young adulthood, maybe 20, 25, that generation of parents really spoiled it for them. I'm sorry if I'm making a very over
Sweeping.
sweeping generalization, but there are exceptions, of course. But they made it so easy for them. Everything is so easily achievable that they don't value anything. And most of them are now looking out for something more in their life. They are not, they've seen all the material happiness, they've got good careers, they've got material wealth, they've got a good house, all of that. But they still are not happy, they are not content. And again, these are more uh, these are more evils, if I may say, or more of a lesser, of a higher degree, I would say that. But this is something we need to know. But again, it comes to the same point, that for each one, it's a different rule. It doesn't apply to everyone. And the change never comes all at once. It's not a tsunami. Society doesn't change as a tsunami. You have to, for each one, the change is for that person, and maybe it will affect immediately 3 4 people around them. It may have a ripple effect, it may not. It may still be seen as bad. A woman working and not managing the house after marriage may work for one household, but it may still be seen as negative for another household, and the future generations or other daughter-in-laws may not be allowed to do it. But at least for that one person, the change has come,
Absolutely.
and
I
they
mean,
have to
I
overcome.
don't think in these sort of things, this kind of it can't be a sudden paradigm shift, and B, there's not going to be a revolution. There's not going to be people taking out dharnas saying, let's end this. And I think as long as there can be that one individual who has the awareness backed by the courage to make certain small steps in his or her micro construct. Yeah.
So I think we need, how do we manage our mental health, is that we need to understand that stress is not always bad also.
Hmm.
That is again another thing we need to understand. And we need to understand, in order, see, if we experience everything, only then can we know what is good. If I don't see the dark side of it, I will not value the bright side,
Yeah.
and I will not strive for it, because it will. So these obstacles are necessary. Uh, the thing here is that we should have enough coping resources, coping skills to deal with it.
Yeah.
Adaptive, effective, which is what we are lacking. Problems have always been there, they will always be there. But what is lacking is that we don't have effective coping skills. Starting with very basic skills of emotional management. We lack the basic skills of understanding our emotions, accepting them, acknowledging them, and then responding to them rather than reacting, right? So those skills are something we need to work at from a primary level. Now, when we talk about it being prevention better than cure, that's what my experience in school has taught me, that we are not doing prevention at the primary level, which is something that is missing. We should mandatory It's mandatory to have a counselor in every educational institute, but those counselors are doing a lot of other work. And how effective they are, they are much more effective than they were 10 years ago, I have to give you that. But we are not going to those counselors, we are not approaching them thinking that they can help me. So we have multi-speciality clinics, we have bigger hospitals will have a psychiatrist, will have a psychologist, probably at least one on the panel. But the small clinics where you and me will go, where common people will go, there's nothing there of a counselor. Today I was attending a webinar, and this speaker was saying that the government here, the state government, had actually got a grant they placed psychologists in with general practitioners for about 6 months to see how the response was, and they were amazed at how many people actually came up. But it's not just that, it's also about creating awareness, the secondary level of early screening, identifying problems early, and going to get help. So many times as a clinical psychologist, when I would see clients outside school, and I would think, why did the school counselor not see this? If she would have seen this before, things wouldn't have gotten so worse.
Right.
Unfortunately, I can't say that about adults, because all the adults I saw, not even one came to me and said that we have a counselor or we have a psychologist
Yeah,
in our company.
unsurprising.
So I mean, I can't expect them, but at least for children, we need to create awareness for our teachers, for our parents, for the school administration. Not every school functions like mine does. When I was working, and they were very, very cooperative, but not every school is like that. But we need to create awareness. We need to not just one lesson in psychiatry for general practitioners and physicians. They are the first point of contact for us people, but more details about what psychology is. And so when I had doctors, a cardiologist referring patients to me saying, the BP is too high, you have to see the anxiety. So that shows awareness, but there
Yeah,
are just maybe a handful of them.
yeah,
And the one thing that I feel, we don't believe in collaborative work. We don't ever refer that this person might be better
yeah.
to, help this client or
Absolutely.
patient I have.
I
We
mean,
never do that.
even if we don't use words such as better or worse, just more appropriate.
We need to change things at that level. And I think that's what I saw in my experience. Maybe if I would have been working as a clinical psychologist in hospitals, I wouldn't have seen that. But I saw that while I was in school. And I thought, what? And I know that of course, the education system needs to be reformed for our field, definitely. We don't teach enough, and it is in the process. I don't know how and when, how long it will take, and when the changes will come. But also I thought so many times, a person with a master's degree in psychology will not be able to tackle this when they're brought to them. So we are hiring people who've done diplomas in. I have no offense if you are good at your work and you learn on the job. There is no denying that fact. In our field, you learn on the job. But there has to be a prerequisite to that. Your counseling skills at least need to be in scale.
Yeah.
You need to have a basic understanding of what you're looking for, so that you can at least screen and identify. Now, that is again another area we need to work on, where that is primary level intervention. We are not doing that as a society. So I don't know if I've answered the question
No,
or
no,
not.
you have very
Just
much,
speaking.
and you have absolutely. And if I was to put it really crudely, what I'm hearing, which is marketing 101, is catch them young. right? So the intervention and the education and the orientation and the sensitization, all of these things needs to begin as early as possible, which I deeply resonate with. My worry, and it literally keeps me up nights sometimes, is how far back does one go, Neha? Because if we were to work on this fairly safe assumption that a lot of neurosis and a lot of problems that subsequently form within us from our mental health standpoint later on in life are embedded in childhood, whether it's inner child, whether it's attachment, whether it's any of those things. How far back do we go? For example, and I'm not trying to be facetious, should there not also be sort of, when couples decide to get married, should they not be encouraged to think really, really long and hard whether they really want to and are able to bring a child into this world and care for it properly? Should they, as individuals, also not be encouraged to first address and sort out their own sort of, issues, things like that?
That's true. A few years earlier, we were discussing we were with our supervisors when I was training, and we were having, this was maybe 12, 13 years ago, and we were having a discussion. And, the fact that instead of matching horoscopes, there should be genetic counseling. That was at that time the biological thing. Yes, there should be psychological profiling. There's no harm in that, going with the increased number of divorces and all of that. But again, one point here is that anything that has happened in my past is precisely that. It's my past. How far, I have no disrespect here for people who want to go to the inner child and all. That's their approach, and I respect them for that. But as a personal viewpoint, I think everything that has happened in the past stays in the past.
But
We need
okay,
to
so
understand the context, but we also need to move forward.
But sometimes, even without getting into the specific nitty gritty of ये हुआ, ये incident हुआ, या इस person के साथ, that is where the dysregulation happened. Even if we sort of put all that aside, sometimes, when you say in pure layman's speak that अरे वो तो past में ही अटका हुआ है, even to get a person out of that mindset requires some intervention.
Absolutely. And that is where I think the spiritual part of it comes forward. And, my thing says that yes, but everything that happens to me, I understand it for other people. But my understanding is that if it happens to me, there's a reason behind it. And I need to work through, now again, mental health, analysis, looking back, reflection, introspection. What do I need to learn from this? It's a better approach that, okay, this happened to me, and no parent is perfect, no child is perfect, no human being is perfect, whether it is you're looking at it a couple or, even friends.
Yep.
Until unless we realize God, none of us are perfect. And that is the first point of acceptance that needs to come in us, right? So what can I learn from this is a more proactive approach. What can I do? What is in my control? I cannot change the other person. I cannot ask you to love me or beg you to care for me. I can only do care for you and hope someday you will return the affection or something like that. I cannot change the other person. The second point is, no matter how many psychological profilings we have, we are dynamic organisms. So even if I do a pre-wedding, pre-child profile and understand that, I will change when the situation actually comes. Because I'm changing and evolving every single day. I'm not the same person I was yesterday. Either. My mood is not the same. My temperament can change. So I also need to understand that it's a continuous process of self-reflection and working on yourself. What worked for me in the past may not work for me now. Okay, so yes, it's different from person to person, but it's also different from time to time. I managed my anxiety by doing deep breathing 5 years ago. That same approach may not work for me because the anxiety is different
Yeah.
and I'm a different person. I may have to do therapy for that, and just deep breathing will not help. So, that is the thing, that you have to be constantly working on yourself. You cannot become passive about it, and you cannot be complacent about it, and you cannot put the blame outside, because the only person we have control over is ourselves. That too,
Absolutely.
if we wish to change.
This conversation can go on and on almost endlessly, but for now, I come to my final query, and I know I've really bugged you with some annoying questions. Another facet of this that I often think about is, particularly again in our country, we are still very much at a stage, I feel, as a society where mental health interventions and help is a privilege for the most part. And we all know approximate statistics of how much of our population is very, very far removed from that space and stage, where literally roti kapda or makan is the only priority and all of that. Now, when we talk about a paradigm shift, a mindset shift, does that mean that for the vast majority of people of our country who are nowhere near this zone, will it therefore just be a question of waiting until sociologically and in other parameters there's a certain amount of evolution that takes place? Or will it be a question of couple of things happening simultaneously, that evolution, but also at the same time the growth and evolution of the entire sort of infrastructure itself, of perhaps psychological testing becoming part of, let's say, routine health checkups, part of your examinations that you are made to undertake when you buy medical insurance, for example, things like that.
I see, of the very basic, coming back to my psychology superior, we know the hierarchy of needs, and Abraham Maslow talked about it. I am in complete agreement that until unless you have the basic needs met, you know, it's very difficult to flourish or even talk about flourishing, you know. So I've interacted with people who've, I'm telling them that you must eat well so that you can be healthy, but they don't have the resources to eat well, to get protein, to get other nutrients for
Yeah.
themselves. So yes, those basic needs need to be met, but that doesn't mean that it cannot happen without them. I need to have certain amount of food. I need to have certain clothing. I need to have some form of shelter. Yes, all of that I need to. But that doesn't mean that I'm not growing psychologically, even in those. In fact, once those, if that's my feeling, I don't know about research, but if you actually take someone out of those circumstances where they're struggling, even if I'm not talking about a very lower economic and sociological status, if I'm just talking about a common middle income man, and you take them out of the struggling atmosphere and you put them in an atmosphere where there is moderate amount
You
of
enable
struggle,
them with.
but it's a better environment, they will flourish quicker than those who are already inundated with so many, who've been served things on a silver platter. That's
Undoubtedly. I mean,
my
you just
personal
look at
feeling.
I would completely agree. You look at the kinds of kids and students who sort of make it through the competitive exams, make it through the IITs of the world. They're all from half-horse towns, having studied under, lamp, street lights and all of that.
And so it is possible. It is possible. Again, uh, coming from a more spiritual point of view, the timing has to be right, grace has to work, and someone has to be compassionate and kind enough to help. That can help. But also, when they see you, what you can do is you can only be a better version of yourself, so that anyone who you come in contact with can at least understand that there's a better way of being. The whole idea is not uh, to be, it's not even to be an inspiration or a role model.
Sure.
It's just the fact that when you change and when you become a better person, your vibrations change. You start affecting people in that way. And it is possible, it is very much possible. And I have very high hopes that India is going to be much better than a lot of countries. And I have full faith in that. Why only hope? That we are going to see a shift coming soon. Um, and that's not from an astrological point of view, but mainly from the spiritual point of view that
Sure.
I know the great people you read about and you hear, I've heard about from my guru, and how they predict things. I have full faith in that. So there is going to be a shift. But the thing is, and the biggest indicator is people are waking up, and the younger generation is waking up.
Absolutely.
That is the biggest positive I've seen. So,
Absolutely.
yes, they've been given a lot of things and they are, materially satiated. That's good. That's why they're looking elsewhere. There are a lot of young people who want to do spiritual, I don't, retreats, even if
Yeah,
that's
I mean,
just
they're
it's a
seeking.
fancy word. They're seeking something other than themselves, and they are willing to believe in something higher than themselves.
Yeah,
So the shift is happening.
is happening. Wonderful. I mean, I'm absolutely delighted that you reminded me of that, because I have very similar observations myself. Well, is there anything in terms of the theme around which we've been talking that you would like to sort of crystallize and leave us with as we wrap up?
I think the first point that I want to make is please understand that mental health is as much a part of your life as physical health is. So that's the first thing that we need to change in our thinking, that you know emotional management, decision making, accepting responsibility, maintaining relationships, establishing healthy boundaries. We do this day in and day out. This is all a part of mental health. So don't put it as something that only someone with a mental health condition would do. That's the first thing. Second thing is, remember that you only have control on yourself, and you only have yourself to work on. Be selfish in the true sense of the word. And this I've heard again from my guru, and she says, स्वार्थी का असली अर्थ होता है स्व प्लस अर्थ, अपने आप को अर्थ देना. So work on yourself. That is something that we need to, and forget about the rest. Yes, you have to be compassionate, you have to be empathetic, but that will come if you start being nice to yourself. I can only give what I have. So if I'm nice to myself, I'll be nice to other people as well. That's something I want to say. And the rest is just don't stagnate. Whether it is physical health, mental health, brain, intellect, anything. I think that is something we need to understand, that we are dynamic organisms. We cannot risk being stagnated. So that is something that will push us forward, whether it is towards spirituality, whether it is towards personal development, whether it is towards anything else. Just that is the main, I think that is what mental health is for me. I cannot stick on to what has happened to me in the past. I cannot stick on to what is happening to me in the present, because tomorrow is going to be a different day. So, and I think I don't want to say anything more. That kind of sums it up. But just
Well,
that's
the fact of the matter is that we call this session mental wellness ethos, but what you've articulated in extremely simple but very poignant terms is pretty much a philosophy to lead one's life. Um, on a lighter vein, the first point that you made, where mental health is not separate, this is mental health. मुझे याद आया suddenly that when I was very young, I was detected with the tonsillitis thing, and I used to go around saying मुझे tonsils हो गया है, until the doctor told me tonsils तो तुम्हारे पास भी है और मेरे पास भी है. So it's like that. But thank you very much. It's so wonderful to interact with somebody who has a, shall we say, a certain clarity, and a certain very, very, very fundamental wisdom. And I really hope and also feel that more and more people are being that way. And I know this personally because I've seen a huge shift in the parents who bring their kids to me for the classes I do, where there's a complete change in the outlook of newer stroke younger parents, whether it is the possibility of their child being on a neurodivergent spectrum, whether it is strife between the man and wife, whatever.
Also, more resources are available, so they are able to reach out. I
Yeah.
think that is again, yes, accessibility has become better over the years, but yes, the paradigm shift, the shift in the mind comes first, and then you can do with a lot of things.
Yeah, well, the mind is the most powerful. So thank you very much. Won't keep you any longer. I've overstayed my welcome in any case. My sincerest apologies for constantly interrupting you, but I was so keen to sort of side with you basically because it's very rare. So thank you. All the best. We wish you more light and more awakening on your path. And take care.
Thank you very much. It was wonderful with all the interruptions, which just, it's a conversation that makes it more enlightening. Thank you.
Thank you.
And you have a good day, and bye bye.